Welcome, everyone. Thank you for joining the inaugural lunchtime chat in the series hosted by Mount Sinai's Institute for Exposomic Research, Environment, and Health. I'm Wendy Mindell-Rubenstein, a member of the Mount Sinai Exposomics and Children's Environmental Health Board. I've been involved with Mount Sinai's environmental health initiatives since 2009. This series of chats is designed as a forum to get your questions answered by scientists who are studying the health impacts of complex environmental health exposures, from air pollution to the chemicals and the products in our homes. We're excited to showcase the discoveries made in Exposomics, which you'll hear more about today. It's a field of science that's revolutionizing the way we connect environmental exposures and to health outcomes. Each week, you'll hear from a different researcher, and we hope you'll come back every Wednesday to join us at 1 p.m. through the beginning of June. Our aim at the Institute is to translate scientific information so that individuals and communities are empowered to make the best possible health choices and advocate for protective policies. Today's presentation will be about 25 minutes, followed by 20 minutes for Q&A. Please submit your questions in the chat. And now it's my pleasure to introduce Dr. Sarah Evans. She's an assistant professor in the Department of Environmental Medicine and Public Health. Dr. Evans's research is focused on the impacts of early life environmental exposures on nervous system development and child behavior. Today, she will provide an overview of environmental health research at Mount Sinai and let us know what to do to protect our own health, as well as advocate for healthier public policies. Dr. Evans, I'm now turning it over to you.
Thank you so much, Wendy, and thanks to everyone who's attending. We launched this webinar series in lieu of a community symposium that we normally hold annually in New York City. And so it's great to see that we have attendance from all over the country using this format. So today I'm going to set the stage for the series by introducing you to the work that we do at the Institute for Exposomics Research. And I'm going to introduce some key concepts in environmental health. And then I'll talk generally about simple steps that you can take to create a healthier environment for yourself and your family. And we'll leave a lot of time at the end for Q&A. So the Institute for Exposomics Research has a mission of uncovering the links between environment and health in order to prevent and treat chronic illnesses. So this is work that we can't do very effectively in a silo. And so we partner with researchers, healthcare providers, community members, advocates, and decision makers to promote policies and practices that are protective. And so I hear from a lot of families and community members about concerns that arise, often due to headlines like these. And while it's important to be aware of the role that environment plays in health, media messaging around studies on these issues can be scary and misleading, and often leave individuals feeling frightened but unsure of how to act. The COVID-19 pandemic has been no exception to this. And it's really brought the role that environment plays in health into sharp focus. So for example, we've seen evidence that exposure to environmental chemicals like air pollutants and endocrine disruptors might predispose us to worse COVID outcomes. We've also seen that environmental factors like substandard living and work conditions, greater exposure to pollutants, and the resulting higher rates of comorbidities are all factors that contribute to the devastating and disproportionate impact that COVID-19 has had on Black and Brown communities. And then the pandemic has also brought national attention to longstanding structural problems in schools that contribute to things like poor air quality, toxicity of cleaning chemicals, and this persistent issue of lead poisoning, which is particularly seen in children in low-income communities. So I hear from many people that this heightened awareness of the impact of the environment on health often leaves them feeling overwhelmed and helpless, and trying to decipher what sometimes feels like a toxic alphabet soup of exposures without really understanding the science behind it can lead to stress and an inability to act. And so we know that stress is also toxic and can compound the effects of other harmful exposures. So the goal today is not to add to this stress, but to lay the groundwork for understanding the role that environment plays in health, and to also provide you with evidence-based strategies to reduce harmful exposures and create a safer environment for yourself and your family. So I'm sure that most of you are aware that rates of chronic diseases like asthma, diabetes, food allergy, childhood cancers and developmental disorders have been increasing steadily over the last couple of decades. And we know that these rates can't be accounted for by genetics alone. And we also know from studies of identical twins where one twin goes on to develop an illness or a disorder and the other one does not, that nearly all diseases have some environmental component. And so when I speak to families and communities, I'm often asked how to choose the safest product, whether that's a mattress or a water bottle or a sunscreen. And unfortunately, these answers are not always straightforward. So believe it or not, manufacturers are not required to test chemicals in many products for safety. And it's almost impossible to know exactly what's in many of the things that we buy because labeling is not required on most consumer products. When it comes to personal care products and cosmetics, not everything is included on the label. So there are byproducts and contaminants like 1,4-dioxane and formaldehyde, which are both known carcinogens that have been detected in things like lotions, shampoos, hair straighteners, and other products. And then many products also contain trade secrets, which are things like fragrance, which can contain upwards of 100 chemicals, many of which are hormone disruptors that interfere with the normal functioning of many body systems and can contribute to cancer risk. So safety testing of all these chemicals in our products really matters because we see that these chemicals get into our bodies. And studies that are conducted by the CDC, called the National Health and Nutrition Examination Survey, or NHANES, on a representative sample of the US population, find more than 200 chemicals in the blood and urine of most Americans. Many of these exposures are found to be higher in children and also in people of color. We have further evidence that these chemicals are actually coming from consumer products and studies that show that the more products a person puts onto their body, the higher their exposure to some chemicals are. Another example is that the presence of certain kinds of upholstered furniture and baby products is associated with higher levels of flame retardants in the dust and bodies of children who reside in those homes. So the health impacts of these cumulative, low-dose, long-term exposures are largely unknown, but many of the chemicals that we've measured in our bodies are associated with cancer, neurodevelopmental problems, obesity, and other chronic health outcomes. So one argument that you often hear, largely from the chemical industry, is that these products contain only trace or very low-level amounts of a chemical of concern. And so the problem with this argument is twofold. Firstly, the dose doesn't always make the poison. And this is particularly true when we're talking about chemicals that interfere with hormones in the body. So here we see an example where the response is greater with increasing exposure. But the inverse can also be true, where a small amount of a chemical can be more harmful than a high dose. And this is really important because a lot of toxicology studies in animals use higher doses than we're exposed to in real life. And what we call these dose response curves can actually be even more complex. For example, they can be a U shape or an inverse U, or even have multiple peaks at different doses. And it's important to note that participants in most epidemiological studies find associations between a chemical exposure and a health outcome at levels that are within the range of the general population, suggesting that these lower background population levels of exposure can in fact impact health. And the second argument that I would make is that small doses of exposure from a single product or source can have additive or multiplicative impacts. So for example, many of us use numerous products each day that contain similar chemicals that can act on similar pathways in the body. And likewise, children whose diets lack variety often can be exposed to pesticide residues or other food contaminants at higher levels than adults who eat a more varied diet. So how do we address this really complex problem of multiple low-dose exposures over long periods of time and their contribution to health and disease? So to make sense of this soup that I referred to earlier, we've shifted gears to consider the exposome. And we define this as the totality of all external and internal exposures that a person experiences across their entire lifespan. And we think of environment not just as chemical exposures, but also diet, lifestyle, our psychosocial interactions, social supports, in combination with our internal exposome, which are things like our genetic makeup, how those genes get expressed, and all of the small molecules in our bodies. So exposomics goes beyond capturing a single point in time to measuring all of these exposures across the lifespan. And you'll hear more about this if you join Dr. Wright's webinar later on in this series. So measuring the exposome requires novel approaches, and much of the research that we do involves studying exposures during pregnancy and early life, and then looking at health outcomes in the child. Now we're able to use new methods to measure an individual's personal environment through things like wearable devices that measure stress response, that collect real exposures in real time, like personal air monitors, apps, and silicone wristbands that can capture many chemicals in our environment as we move about our day. And we can go back in time to recreate our exposure history. For example, Alan Just, who will be speaking later on in this series as well, is using NASA satellite data to look at air pollution, climate factors, and temperature over time. And we can also use baby teeth to recreate historical exposures that occurred going back as far as fetal development. And this is a method that you'll hear more from Dr. Manish Arora later on in this series. And then lastly, we've developed new statistical methods to understand how exposure to mixtures of chemicals impacts health. So Exposomics looks across the lifespan, and much of our focus is on fetal development in early life, which we refer to as windows of susceptibility, which are periods when developing systems are undergoing rapid growth and they're more sensitive to environmental exposures. The brain and the reproductive system actually continue to develop beyond the second decade of life. So we see that teens and young adults also continue to be vulnerable as they age. And so there are a number of reasons why children are more susceptible to environmental exposures than adults. They're closer to the ground where more chemicals settle in dust and in soil, and they're more likely to put their hands in their mouths. They also breathe faster than adults, which puts them at greater risk of inhalational exposures. They eat a less varied diet. Think lots of Cheerios, mac and cheese, applesauce, and they eat more and drink more per their body weight than adults do. So exposures through foods are also higher. So all of these normal behaviors account for the finding that children experience higher exposures to some chemicals than adults. And then we're also seeing some unique and emerging exposures that older children and tweens and teens are experiencing through things like e-cigarettes and social media. So the exposome also takes into account individual differences that affect disease risk. And it's important to remember when you read headlines like we looked at the beginning, that studies estimate risk at a population level, and not everyone who is exposed will go on to develop a disease. So Francis Collins, the director of the National Institute of Health, has been quoted as saying, genetics loads the gun, but environment pulls the trigger. And so exposomics really allows us to look at not only how genes and environment interact, but how multiple exposures interact with one another to affect risk. And in this way, it should allow us to get a complete profile of an individual's disease risk and then help them personalize their lifestyle to reduce that risk. So we can't really have a discussion of susceptible populations without mentioning health disparities and environmental racism. I mentioned earlier that NHANES data, as well as many other studies, find higher exposure to toxic chemicals in persons of color. And this is largely due to systemic, institutionalized policies and practices that put them at a greater risk for exposure. So for example, hazardous waste facilities and other point sources of pollution are often more likely to be sited near communities of color. And this is associated with poorer health outcomes, like what you see here, an increased risk of childhood asthma in Black children as compared to white children. Similarly, Latinx agricultural workers and their families are exposed to higher levels of pesticides than the general population, which put their children at risk for increased neurodevelopmental disorders. Many personal care products that are targeted to Black women contain higher levels of toxic chemicals like formaldehyde and endocrine disrupting chemicals. And this may account for some of the observations that this population experience a higher rate of earlier onset and more aggressive breast cancers. And then lastly, multiple exposures experienced in these communities can also lead to worse health outcomes. So exposure to chronic stress and violence in these communities can compound the impacts that these chemical exposures have on their health. So I stated at the start of my talk that the research that we do is guided by a desire to prevent and treat diseases of environmental origin. And so to this end, Mount Sinai is also home to the Region 2 Pediatric Environmental Health Specialty Unit, or PESU, which is part of a national network of healthcare providers with expertise in environmental health. And our pediatricians provide consultation services as well as an on-site environmental pediatrics clinic. And we also serve as the data coordinating center for the New York State Children's Environmental Health Centers, which is a state-funded network of 7 medical centers across the state of New York. It's the only network like this of its kind, comprised of healthcare providers who have expertise in children's environmental health. And we train healthcare providers and communities, as well as provide consults and treatment related to environmental exposures. So I think the biggest impact of the research that we do in environmental health can be seen when it's applied to advocacy and policy. And so we often support initiatives and policies that protect public health. And likely you have seen news reports about a recent congressional report that was released just last month that found heavy metals like lead and arsenic in many common brands of baby foods and called upon the FDA and manufacturers to implement better oversight and regulations on heavy metals in foods. So this report was greatly strengthened by the scientific literature showing harmful effects of early life exposure to heavy metals, and cited a review published by some of the researchers at our institute, Allison Sanders and Robert Wright. The report received a lot of media attention, and you can, I'm sure, imagine the stress that this caused parents of young children. And because of our expertise in this issue, we were able to respond to this report with information for families and actionable steps to reduce heavy metals exposure through food and other sources via media interviews, educational materials for parents and healthcare providers, and social media messaging. So this is a great example of where science can really support advocacy and education efforts to protect the general public. So there are really, I think, 3 effective approaches to reducing harmful exposures. And the first is what you can personally do starting today. And that is to make small but potentially high impact changes to your personal behavior. So many of the chemicals in the marketplace today, like endocrine disrupting chemicals and pesticides, leave the body very quickly. And so we've seen through scientific studies that swapping out personal care products or foods for products with fewer chemicals of concern can actually have a very rapid effect on reducing body burden, really over the course of just a few days. And one of the most effective ways to make change is through using your power as a consumer. And so a great example of this is the story of bisphenol A, or BPA. So BPA is no longer permitted for use in baby bottles. BPA is a plasticizer that's added to many hard plastics and also the lining of aluminum cans. And moms became very concerned about the presence of BPA in baby bottles based on some emerging evidence that BPA could be harmful to the reproductive system and perhaps influence cancer risk. And so moms let baby bottle companies know that they didn't want to purchase these BPA containing plastics anymore, and manufacturers began to offer BPA free products. This then led to a select number of states starting to ban the use of BPA in baby bottles. And eventually, several years later, the federal government did ban BPA from baby bottles. But this really started with individuals who did not want to purchase these products, putting pressure on the marketplace. And then lastly, stronger regulations have been shown to effectively reduce exposures at the population level. So after the neurotoxic pesticide chlorpyrifos was banned for residential use, children in New York City communities where it previously had been used saw a 10-fold reduction in their chlorpyrifos exposure. And we've seen something similar with phthalate chemicals, a class of chemicals that are used in plastics and also fragrance, which were banned by or restricted by the Consumer Product Safety Commission for use in many children's products. And over the last several years, we've actually seen up to a 50% reduction in phthalates in the bodies of most Americans following these restrictions. So Oops. In addition to making these product swap outs, there are other really easy, free, and evidence-based steps that we know will reduce your exposure to harmful chemicals. So these are things like removing your shoes at the door, washing your hands with plain soap and water, ventilating by opening windows or using fans, eliminating the use of fragrance, and cleaning up dust where chemicals settle. These are all strategies that you can use to reduce chemical exposures at home and for your family. And so hopefully I've given you some good news and some strategies that can empower you to make some simple changes and to reduce your exposure to chemicals of concern. And lastly, I want to highlight the fact that the exposome also considers positive exposures and the effect of an enriched environment and good social supports on counteracting some of these harmful effects of other exposures. And so it's important not to minimize the positive things that you may already be doing, like reading with your child or providing opportunities for play. And we do know from studies in rodents that, for example, some of the harmful effects of exposure to lead, some of the brain damaging effects of exposure to lead can be mitigated by providing an enriched environment to those animals. And the same goes for humans and for our children. So if you would like to learn more about the work we do and get more information on how you can reduce environmental exposures, you can visit our website or you can follow us on social media. I'd also like to point out that we have some story and activity books that we've created for children that are free for download. And I'd like to acknowledge all of the individuals behind the work that I described at the Institute for Exposomic Research, as well as our PASU and NICE-Check teams. And much of this work is supported by some large center grants from the National Institute for Health that focus on translating research for communities and healthcare providers. And I'd like to invite you all to join us next week when Dr. Homero Harari will discuss the work that he's doing to assess exposures related to cleaning chemicals and disinfectants. And now I will turn it back over to Wendy so we can answer any questions that you have.
Thank you, Dr. Evans, for sharing this important information with all of us. Before we start the Q&A, I wanted to invite everyone who joined us today to get involved. Please help us spread the word. Invite your friends, family, and colleagues to tune into the series to learn more. We hope you will follow us on social media and help to amplify our message. If you have concerns in your own community, from questions about the safety of artificial turf on playgrounds to clean water, our scientists are available for speaking engagements and also to help answer your individual questions. Please don't hesitate to contact us. We're also building a new board, as well as a general community of supporters. I've been a board member and volunteer since 2009, and it's been a very rewarding experience for me. So if you're interested or want to learn more, please contact Brooke, and you'll see that her email address is on the slide. Okay, so now we'll get to everyone's questions. And we have several questions coming in. So if we can't address all of them, please note that Dr. Evans will be answering them on social media using the hashtag environmental chats. So, okay, so here's the first question. There's an entire movement around cleaner cosmetics and personal care products. What do you recommend to individuals looking to make better consumer choices? And related to that question, what resources are available to help make better choices in general as a consumer?
Yeah, that's a great question. So, so first I will say that there has been really great progress in getting more products that are better choices and that contain less chemicals of concern to the marketplace. And so there are many really reputable companies that have increased their transparency in terms of what goes into their products, what their safety testing is, and what they don't include. And so I would say, my number one recommendation for what to look for in personal care products, which is a fairly easy one, is to look for products that are fragrance free. And so by avoiding fragrance, you can avoid exposure to upwards of 100 chemicals. As I mentioned earlier, many of those are associated with hormonal disruption, including phthalates, which is a large class of chemicals. And so, so in terms of resources that you can find to help you sort of sort through this, there are some pretty good resources depending on how much information you're looking for. So Environmental Working Group maintains a database of cosmetics that flags and rates rates different products based on their ingredients. So that's one source that you can use. And there's another new resource that's just coming online, which is actually a Chrome extension that you can add to your computer that works through some search engines like Amazon and Sephora to help you do something similar to what EWG is doing. So I would say that there are an increasing number of resources like that available. My personal strategy is to look for products that don't contain some of the contaminants that we have more evidence for causing harm. And that, as I said, a big one would be to avoid fragrance.
Great. Thank you. So the next question, we're approaching tick and mosquito season. What guidance do you have around safe products to protect individuals?
That's also a great question. We do have a resource that we created last summer. And so if you go to our website, you can download a fact sheet that we created that gives you a little bit more guidance on protecting yourself from insects. And so, this is an issue where there's a real risk-benefit equation that you need to think through. There are a number of strategies, sort of non-chemical strategies that you can take to try to avoid both mosquito bites and tick bites. Things like wearing long clothing, tucking your pants into your boots, doing really thorough tick checks when you come back from an area that may be populated with ticks, and avoiding long grasses, avoiding areas where ticks often dwell. But when it comes to needing a chemical barrier or a chemical repellent, there are some really serious risks to tick-associated diseases and mosquito-borne diseases. And so it is important to protect yourself from those. I think that many people think that DEET, the active repellent ingredient DEET, has a really bad safety profile, but actually it is relatively safe when you use it at lower concentrations. And so using 100% DEET is never recommended. We usually recommend something like a product with a maximum of 20% DEET. So the lowest concentration possible to provide you with adequate protection. This is sort of a choice, a personal choice that people have to make based on, where they are and what their exposure to insects is. But we do, for circumstances where there is a high risk of insect-borne diseases, we do recommend that DEET can be used safely when used properly.
Great, that's really helpful. Okay, so the next question, are there any efforts to promote legislation to regulate exposures in daycares and daycare centers and schools?
That's a really good question. As I mentioned earlier, the COVID pandemic really did kind of bring into focus how substandard many school environments are. And at Mount Sinai, through the PACU and the New York State Children's Environmental Health Centers, we get a lot of inquiries about poor conditions in schools, things like mold and poor ventilation. And so I'm not aware of any specific state or federal initiatives. The EPA does have a really great program, which is called the Tools for Schools program, which works to improve indoor air quality in schools. And it's something that I really recommend anyone who is affiliated with a school or has a school-age child to inquire with your school about starting a Tools for Schools committee. It usually consists of administrators, teachers, parents, who all come together to make sure that all of the recommendations of the EPA for good air quality are being addressed by the school and by the district. So there are a lot of resources available for that from EPA. There's also an organization called the Children's Environmental Health Network, CEHN, which is a great resource for their eco-healthy childcare program. And so they actually have training programs for early childhood centers to get up to speed on better, safer, more environmentally friendly practices in those programs.
Great. Okay, so the next question. A lot of products say antimicrobial, even things like baseball helmets. Should those products be avoided, and what labeling should you look for?
That's a great question. So when a product says that it's antimicrobial, it often contains antimicrobials like triclosan, or even increasingly now nanosilver, a nano form of silver is being used as an antimicrobial on a whole host of products. What I would say is that it's not necessary for those products to be antimicrobials, to contain antimicrobials. You see this on socks and pencils. And, in addition to potential chemical exposures through whatever antimicrobial has been added to those products, there's a concern about antibacterial resistance through overuse of antimicrobials. And so I would say that, this is a trend that really bothers me, and it's really unnecessary. And so where you can avoid that, I would suggest avoiding that.
Okay. Okay. Next question. Are you available to speak at community board meetings or other forums to advocate for change?
Yes, that's something that I and others who I work with do frequently. And I'm sorry, I accidentally closed the last slide when Wendy was talking, but I think that was one of the bullets on there that, yes, if you reach out to us at Mount Sinai through the Institute, we are often able to talk to community members and schools and PTAs about environmental exposures.
Okay. Next question. Are air purifiers helpful? Do you recommend a specific one?
They can be helpful in certain settings. We get this question a lot as it relates to COVID, and that's a little bit more difficult to answer. They can be helpful, particularly if you or someone in your household has respiratory issues or respiratory allergies. It depends on what it is that you're trying to purify from your air. It's really important to avoid any purifiers or air filters that create ozone that can actually make your air quality worse. But an air purifier that has a HEPA filter, a high quality HEPA filter, can be really useful. So it just depends on what you're looking for. I would just caution against some of these newer technologies, ionizing technologies and add-ons and things like that. May have technology that's not necessarily beneficial.
Great. So the next question, why are we in this situation? Why are harmful ingredients allowed in the products we use?
Yeah, so I mentioned that we have issues with the federal regulations around what can be used in products. And so a lot of this has to do with very old, outdated legislation called the Toxic Substance Control Act, or TSCA, that was implemented in 1976. And so there are more than 80,000 chemicals that have come into the marketplace since World War II. And when TSCA was implemented, it was meant to regulate the safety of these chemicals. But what it actually did was grandfather something like 62,000 chemicals to not need testing. And it really hasn't had the regulatory teeth that it needs to have to hold manufacturers accountable. And so that was actually amended. TSCA was amended in 2016. There's hope that now EPA will have more power to hold manufacturers accountable for testing of chemicals that are in products. But as it stands, we're very limited in our ability to test the chemicals that go into our everyday products, just given that there are so many for safety. And they're often not, chemicals may be tested one at a time, but they're often not tested in combination. And so we know, for example, from some studies of the pesticide Roundup, which contains the active ingredient glyphosate, that some studies actually show that the combination of chemicals in that finished product may actually be more toxic than the individual chemical itself. So it's complex.
Definitely.
I will say, I did want to mention that that we have seen a good bit of progress at the state level. And so New York State last year actually passed the Child Safe Products Act, which is trying to work at the state level to restrict the chemicals that are permitted in products for children. So where the federal government sometimes lags, states have stepped forward on a lot of these issues.
Well, that's good news. All right, so the next question, okay. Hand sanitizers can be abrasive. What do you recommend a more natural approach?
We recommend, when it's possible, that soap and water is really the best strategy. A plain, fragrance-free bar of soap and water is more effective and potentially less harsh. That's not to say that hand sanitizers are not safe. Hand sanitizers can be useful. If possible, we recommend an alcohol-based hand sanitizer of at least 60%, but a fragrance-free when you can find it. I do know that some have added aloe or moisturizers or something if you have to use them frequently that can be a little bit gentler on your skin. But we don't consider them harmful. We just recommend that you use soap and water when it's possible.
Great, thank you. Have you heard of companies adding silver to clothing? And are there health concerns there?
Yeah, I think a lot of that is really underexplored and largely unknown, but this goes back to the antimicrobial question, where many products, including clothing, have nanosilver added to them as an antimicrobial. I think that's the situation where I've mostly seen it. And I have seen some documentation that the silver actually leaches from the product in the laundry and can get into the water supply and can contaminate other items that you're washing. So I'm generally a little bit leery of that. But we're still, the science on that is still emerging. Meanwhile, and this gets back to your question about regulations, because there isn't really good safety testing before all of these things get out into the market and pervade all of our products. Now we have to play catch up. So it's already out there in widespread use, and the science hasn't really caught up yet to determine whether or not it's safe.
Okay, thank you. Can you talk about the dual consequence of COVID and climate change, particularly on Black and Brown communities?
Yeah, that's a great question. And there's a lot to unpack there. And, I'm grateful for that question. And I think we needed, I had a couple points about that, but I think we needed an entire hour to talk about that topic. But yeah, so communities of color and low income communities are more impacted by climate change because of, as I mentioned, similar risk factors that put them at risk for COVID-19 severity, which are things like substandard housing. In the case of climate change, often being sited in a flood zone, not being able to rebuild or relocate, and also being more subject to heat injury, air pollutants that are increased through climate change. And then at the same time, so all of the health impacts that climate change are having are also predisposing people to worse COVID-19 outcomes. So, this is something that has really come to a head. It's terrible, but it's also good that it's now sort of front of mind. And I hope that COVID-19 has raised greater awareness, of both the health impacts of the climate crisis, and particularly, as it impacts Black and Brown communities.
Thank you. Okay, next question. Are personal care products marketed as vegan a safer alternative?
I don't see why they would be. I mean, we all buy products for different reasons, whether we deem them to be safer or whether we purchase them for ethical reasons. I don't know of any reason necessarily why a vegan product would be safer for, for your own personal chemical exposures, because they could certainly contain things like synthetic fragrance. And, this also sort of touches on a phenomenon called greenwashing, which, sometimes a product will say that it's all natural, or it will say that it's vegan, or it will say that it's eco-friendly, and it doesn't necessarily mean that it's safer for you to use. And there really isn't good third-party testing to verify any of those claims. And so, often I think we're drawn towards a certain product because we perceive it to be better for us, but in actuality, it may not be.
All right, so back to baby food. Is there a good resource that explains the current state of the research and next steps to help alleviate the concerns of parents and caregivers who need to feed their babies?
Yeah, that's a great question, and that's largely what our team tried to respond to in the face of this breaking information about heavy metals in baby food. And so we do have resources. If you visit nicecheck.org, our New York State Children's Environmental Health Centers, we put together some resources for families to help navigate these choices. And there's also ongoing, if you take a look at that resource, you can link to other resources that will help you find some of the ongoing advocacy that's going on around this. So the authors of the congressional report that I mentioned are putting pressure on FDA to better regulate heavy metals in foods. And so hopefully the next step from that report is going to be to introduce legislation that would do so.
Thank you. So we have 2 more minutes. And we have time for one more question. Dr. Evans, you shared a lot of great information today. If someone is new to this, where should they start?
Yeah, so I recommend taking a look, doing a sort of a survey of your own environment, your own home environment, and starting very small. And so, as I mentioned, there are studies where changing your cosmetics or switching some of the foods that you consume to organic from conventional just for a few days can dramatically reduce your exposure to some of these chemicals of concern. And so taking small steps to begin with, rather than throwing out everything that you own or changing over everything that you own. We've had a question, should I throw out my couch? Should I throw out my mattress? And no, you don't need to do that. You shouldn't do that.
I had that question one time.
Maybe it was you that asked, but I would start with something like, plastics are, plastics can leach chemicals into our foods and beverages, and they're also just really terrible throughout their entire life cycle. So plastic production and plastic waste is a major contributor to climate change, which has, a whole host of health impacts. So by just taking a look at, what plastic products am I using in my kitchen? What can I change over to glass or stainless steel? Am I using a lot of reusable products that I don't need? Starting with something small like that. If you're using a plastic water bottle, change over to a reusable stainless steel water bottle. So it doesn't have to be everything at once.
Thank you. That makes it more tangible. So thank you so much, Dr. Evans. I'll share the questions with you that we didn't get to today and look forward to seeing your responses on social media. And thanks so much, everyone. Enjoy the rest of your day, and I hope you'll join us again next week for our talk about exposures to cleaning chemicals and disinfectants.